Is HRT safe? When two major studies, the Women's Health Initiative and the Million Women Study, were published 20 years ago, they sparked concerns about HRT's long-term safety, linking it to increased risks of breast cancer and heart disease. But in the years since, reanalysis and newer research show that for women starting HRT around perimenopause or early menopause, the benefits often outweigh the risks. For most healthy women, HRT can be a safe way to manage symptoms as long as the benefits and risks are carefully balanced. HRT can increase the risks of blood clots in the legs or in the lungs, especially in the first year. And the risk is about 2 to 3 times higher than in non-users, but it's still lower than the blood clot risks of pregnancy or when you're taking birth control. Transdermal HRT is a safer option that doesn't increase blood clotting risks. And the risk of stroke is slightly higher with oral HRT, but for women under the age of 60, the absolute risk is minimal. Again, using transdermal HRT is a safer choice here. Next, the breast cancer risk. So combined HRT, estrogen and progesterone has been shown to slightly increase breast cancer risk, especially after 5 years of use. This risk rises gradually and then faster after 5 years, but is still relatively small. It's about 1 extra case per 1,000 women per year. Lifestyle factors like smoking, obesity and alcohol intake can also impact breast cancer risk, often at similar or higher levels than HRT. Endometrial cancer, well, for people with a womb, estrogen-only HRT raises the risk of endometrial cancer, which is why progesterone is added in to balance that risk. This combined HRT approach nearly eliminates the risk of endometrial cancer. Heart disease, well, for women over the age of 60 or those who start HRT more than 10 years after the menopause, there might be a slight increase in heart disease risk if they already have cardiovascular risk factors. However, starting HRT within 10 years of menopause has been shown to decrease the risk of heart disease in the long term. So the bottom line, for most healthy women or people under the age of 60 who start HRT in early menopause, there is a favourable benefit to risk ratio. Every person is different, so it's essential to talk to your healthcare provider to decide on the safest approach for you based on your individual health profile and your needs. For an in-depth discussion and a review of the evidence, head over to the Menopause Symposium YouTube channel for more.